This patient came into the office with a piece of metal in the eye. You can see here by the image that it's actually starting to rust a little bit. Luckily for him, it's off axis, meaning that it's more in the peripheral cornea, not within the visual axis. I say lucky because if it was actually in the visual axis, it can cause scarring, it can cause other problems, and the patient can lose best corrected visual acuity. And this piece of metal has been there for about 6 days, so we're going to remove it. The first step is to numb the patient's eye, and we do that very simply with an eye drop. It will numb all the corneal nerve endings, and the patient will feel extremely comfortable. And the first instrument you see here is called a spud. And the spud is actually like a small little hockey stick where we can kind of scoop underneath the foreign body. In this instance, the foreign body popped out nicely, but it didn't land right on the spud like you would ideally love it to. It actually went onto the surface of the cornea, and I do not want to create any further trauma to the cornea, so I kind of move it off to the side where it's a little bit safer to remove. Now, looking at this image, you can see a ring there. That is called a rust ring, and we do need to remove all that rust that is still foreign substance in the patient's cornea. The next step is we use what's called the Elder brush. And when you look at the tip of it, it's almost like a round ball with little striations in it, and as it revolves, it actually can pull all the rust out of that corneal tissue and allows me to remove the rust and polish the surface of the cornea. And I periodically take breaks. I actually rinse the tip off because it's getting clogged with rust, and I like to rinse it, and then the irrigation fluid helps me clean and polish that cornea. So one of the most crucial things with any corneal foreign body, the sooner we catch it, the better. If the foreign body is there for a long period of time, the rust actually starts to migrate in the deeper layers of the cornea. So what we'll have the patient do is return in maybe 24 or 48 hours. The rust actually migrates to the surface of the cornea, and then we take the brush again, and we can remove all the residual rust. If the foreign body is closer to the visual axis, we really want to be aggressive and try to reduce any scar tissue that may form, because the patient can lose best corrected visual acuity. And what that means is when everything is all done, if I prescribed you eyeglasses or a contact lens, you're not going to see 20/20 due to the scar tissue that's on that cornea. Now, on certain instances, and this is why it's incredibly important to come in, especially if you have a metal foreign body, because again, metal rust. If you wait a long time, that foreign body will almost cause the cornea to melt, and it can become deeper and deeper and deeper into the cornea, to the point where some patients, due to a simple metal foreign body that we could remove at a microscope, needs to go into the operating room because the cornea is so soft, we can't remove it. Luckily for this patient, everything came out nice and clean. The rust was removed. We sent him home with topical antibiotics, Tylenol for any pain that they may have. The patient will do great within 24 hours. Most of the patients I will have return back in about a week to just double check that area that we removed. I want to make certain that there's no scarring, make sure there's no residual inflammation or swelling there. And providing I'm happy with it, they're done, and then we just see them for their normal eye care.